chemotherapeutic agents, as I told you, they target the cancer cells, and these drugs have an affinity for that. They enter the normal cells also, but mostly taken up by the malignant cells, and they are cytocidal. That means they kill the cancer cells. That is one. Secondly, they also prevent the multiplication of the cancer cells. So that is hyperplasia. The cancer cell will not divide further, and that is the end of the cell cycle, and the attrition occurs. The cell attrition occurs. So these are the various types of modalities by which the chemotherapy agents work on the cancer cells. Yeah, when there are good effects of chemotherapy, there are also side effects, obviously, and the side effects can be mild, moderate, or severe. The mild symptoms or side effects being, sickness, nausea, and then vomiting. This is mild. Sometimes irritability or burning sensation in the mouth, that is called mucositis because of chemotherapy agents, and dryness of the mouth. There is also what is called alopecia, or temporary loss of hair. So these are the common side effects you find, but the major problem is what is called uh, diminution of blood formation, and in medical language it is said myelosuppression. So the bone marrow, where in adults, where the blood is formed, various elements of the blood, including the red blood corpuscles and white blood corpuscles, platelets are formed. These are the main components of the blood. The bone marrow is suppressed. When there is suppression of bone marrow, the blood counts fall, including the RBC count, white cell blood count, and hemoglobin. Because myelosuppression is one of the major side effects, and that's why before giving chemotherapy, which is generally given in cycles with a gap of about 3 weeks average between one cycle and the other, the bone marrow takes time to replenish. So the observations over a period of time by various scientists centuries down have formulated that the gap should be around 21 days, wherein the myelosuppression effect, serious side effect of the chemotherapy is overcome by the body, and blood counts are brought to near normal level, including white cell counts and RBC and hemoglobin. So that's why 3 weeks gap is generally advised. Like in radiotherapy, 5 days in a week is given, 2 days the rest is given, so that the body recoups the original energy and also the blood counts and others. This is the rationale behind giving chemotherapy in cycles. One cycle means it can be one drug or multiple drugs. It can be 1 day or more than 1 day. It can be 3 days sometimes. So depending on the various combination of drugs and the disease stage and diagnosis, the chemotherapy agents are given in different proportions over a period of time, and each cycle once ends is given a gap of 3 weeks generally. Sometimes the chemotherapy is also given in small doses, day 1, day 8, and day 15, like that. It all depends on the stage of the disease, and also importantly the performance status of the patient. Performance status means the normal physical and mental activity, especially physical activity of the patient, who is not debilitated, who is not weak, whose counts are regular, who is able to ambulate himself more than 12 hours in a day. Depending on all these factors, the performance status is gauged, either stage 1 to 5 like a COX, or 1% to 100% like in WHO scale. Depending on the performance status and the situation and stage of the disease, the chemotherapy is advocated.